Welcome back to my channel. This is Dr. Karen Amaniampong and this is Sweet Talks with K. Today is going to be very interesting. I have a very special guest. In fact, my first guest on the show, on my channel, my very own daddy, Dr. Kofi Amaniampong, who is a specialist obstetrician and gynecologist. He is a member of he's a fellow actually of the Royal College of Obstetricians and Gynecologists in UK. He's a fellow of the Ghana College of Physicians and Surgeons and also a fellow of the West African College of Physicians and Surgeons. Hello, Daddy.
Hi.
Welcome to my YouTube channel.
Thank you.
So his field of interest actually is infertility. So he's a fertility specialist. And today we're going to talk about infertility. He's going to tell us the ins and outs of infertility in the first part, and the second part of the video we're going to talk about IVF, which a lot of you would like to know about as well. So welcome. What do you have to say? Are you excited to be?
Very excited.
Show the excitement.
Well, good.
Okay, so what is infertility?
Well, infertility is a condition where a couple have been married for more than a year with unprotected vaginal intercourse without being able to become pregnant. So that's what is meant by infertility.
So it's trying for a year.
Yeah.
So it has to be 1 year, not less, not more.
It has to be 1 year, but there are some situations where you can reduce the 1 year to less than 1 year. You can reduce it. And these situations are: one, if the woman is more than 35 years of age, and the second one is that if the couple themselves think that there is a reason for them to come and seek help earlier.
So in other words, it means you should seek help earlier if you feel like you might be trying harder than someone who is younger or somebody who doesn't have any complications. So less than 1 year for other people.
Yes, that's correct.
And what are the causes of infertility? Are there any identifiable causes or?
Yes, there are identifiable causes. It can either be due to the male, the man, or the woman.
You know, it's interesting in our culture, people think that it's mainly a woman who is the cause of infertility. So I'm glad that we're mentioning it here, that there can be male factors as well as female factors.
Yes, and that's quite true. If we take it, looking at this picture, that will make it a bit easier to understand. First of all, this is what the woman uses to make a baby. First, we have the vagina, which is the front passage. Then you have the womb, which is the uterus. Then you have the fallopian tubes, and then the ovary. And it is the ovary that will produce the egg. Now, the causes, when we take first, the man will have to deposit the semen. And the semen contains the small cells we call as sperms. And these sperms, within 2 minutes, will quickly, find their way into the womb and enter into the fallopian tube. And then when they get close to the ovary, and they are quite close to each other, and there is an egg produced, the two will join together to make a baby. So looking at this, it means that our first investigation will have to be trying to see whether the man has got quality sperm, the quantity is good, and the morphology is good. That is, the form of the sperms are good. And we know that in our modern distance, we take about 50 million of the sperms per male to be the normal.
You said in our modern, so it means that the values have changed.
The values have changed over the years. When I was a medical student some years back, it used to be 80 million. 80 million
and now it's 50
80
million.
million in about 1970, between 70 and 80, it was 80 million. Then when 1980, it was reduced to 40. And then reduced 1990 to 20. Now, 1999 is being reduced to 15 million. So then we come on, the second cause is the womb. It may be due to the womb with fibroids or with fibroids. Then when you have the tube may be blocked. And then you have the ovary, which may not be able to produce the eggs. Okay. So these are the causes. Of course, there are some other situations where you can't explain. And that one, that will constitute about 15% of those who can't have babies, who have infertility problem, who will have a condition known as unexplained. And unexplained is that everything looks normal, but at the same time, we can't explain why the pregnancy can come. And they may need some kind of help.
So that's for the female cause?
That's for the whole couple.
The whole couple?
Yes.
And the male causes?
The male causes, well, the male causes, as I've said, is maybe due to the quantity of the sperm, the quality, and then the form, the forms of the sperms.
So it looks like over the years, you said the sperm, the value we're using was 80 million, it's come to 15 million. What are the reasons? It's
been very difficult to explain what the reason is, but it has been blamed on the normal changes in the world that are occurring, like the climatic changes and so on, our lifestyle habits, like smoking, that has seemed to have affected it. Mm-hmm.
And how common is infertility?
Infertility is quite very common. If you take the population, it's about 15% of couples who are married may be infertile. So, and it is very common. It's becoming a little bit common now for two reasons. First, because of the age group. Now, women are postponing the ages of making a baby. And at the same time, also it's been found out that sexually transmitted diseases are becoming a little bit more common than about 20 years ago.
And that contributes possibly to the blocked fallopian tube?
Yes, please.
And is 15% worldwide or Ghana or...
Well,
we have an international audience. And
yes. Well, we have primary causes, that is primary infertility and secondary infertility. Primary infertility is when the woman had not had a baby at all, and then the secondary will be due to having had one baby, but from then on it becomes difficult. It's been found out that the secondary infertilities are common in the tropics because of one or two reasons. And the primary infertility is just the same.
Okay. Mm-hmm. And what's the trend? Are you seeing what type of patients?
Well, we seem to be seeing equal number of those who are primary and then the secondary. But in our sub-Saharan countries, it appears as if we're having more secondary infertile patients because of the way they go through the labor. And you may go through labor and then develop complications like inflammation that may occur without you recognizing and affecting your tube.
Okay. And so for someone who has infertility, what investigations do you do for them when they come to you?
First of all, we will take the male. The male, we do common semen analysis. And as I've said, the values have changed over the years, but now we take about 50 million as being the normal. Anything below is abnormal. Then when we come to the womb, we just use ordinary ultrasound, ultrasound scan, or we may do CT scan, or we may do MRI to be able to identify the fibroids and that sort of thing. When we come to the tube, the commonest we use in our environment is Hysterosalpingogram. That's an X-ray of the tube, where a medium is passed through, and then find out that it come into the pelvis.
But there are limitations for the...
Yes, there are limitations.
Hysterosalpingogram is HSG.
HSG, yes, HSG. We can also use the laparoscopy. HSG is cheaper but more painful. It will also give you about 80 to 90%, but laparoscopy is the ideal to use it, because with that one, you are using just the same, but observing the dye being deposited, coming out through the ends of the tube. Okay. Then we will need to do some hormonal tests to check whether the ovary is producing eggs at the appropriate time. Good.
And how is infertility? So when the diagnosis of infertility is made, all the investigations are done, what treatments, modalities?
First of all, you would have to find out the cause. We have examined the lady, we have examined the man, so we know the cause. But we will normally use the first approaches to teach the couple about the fertile period, because most people are not really aware of the fertile period. And I would think that instead of using all these gadgets that will test for your ovulation and all that, I would suggest that I use the simple method. The simple method is that we know that the period that the egg may come, that is the cycle, the menstrual cycle. So I would say that instead of exact ovulation day, you can come 2-3 days before the ovulation day, 2-3 days before, after the ovulation. So that is you teach the fertile period. Then after you've done that and you're proving that the tubes are okay, you can go on to simple super ovulation. That is, give medications to try and entice the ovary to produce an egg.
So how long will you, for the super ovulation, that's like giving medications like clomiphene or Clomid. How long would you usually recommend? Because you sometimes find people coming and saying they've been taking the Clomid for many, many months and they are not falling pregnant.
Well, the advice is that you should not use more than 6 consecutive times, because anything above that, we are a bit afraid that you may develop complications like a cancer of the ovary in future. So we advise that you should not go more than 6 times.
Okay. And what other?
Then the other method is that you also use something called timed intercourse. Timed intercourse is where you do the superovulation and then you time the time that the egg will be released, and then they have intercourse at that time. Then the other one is that you have intrauterine insemination, where you take the sperms.
That's IUI.
That is the IUI, intrauterine insemination. Then you take the sperms and then remove those that are good. And instead of putting it into the vagina, the sperms are put into the uterus for them to find their way into the tube. Then if that doesn't work, and with that too, you need to do about 3 times, 4 times. After that, you have to give it up if it doesn't succeed. The success rate for the IUI is just about 5%. Some centers will quote it as 12%, but that involves younger girls or younger patients. But on the average, it will be about 5%.
But what if the couple doesn't want to do IUI, or they don't want to try so many times?
Well, if they don't want to do IUI is cheaper and safer, so you will have to advise them. If everything is okay, when I talk about everything be okay, especially the tube being patent. And if they don't want to do that, then, or if the IUI fails, then you go on to do IVF, in vitro fertilization. That is, you stimulate the ovaries to produce more than 2 or 3 eggs, and then you remove the eggs through the front pass, through the vagina, and then bring them outside and add the sperms to it, and make the babies outside. And after, when the babies are made outside and it's within 1 to 5 days, you will transfer the formed embryo, that is the formed baby we call as embryo, and then you put them into the, uterine cavity. That's the IVF.
Okay. So what advice about fertility do you have in general or specifically as a fertility specialist?
My advice is that couples who think they will have a problem, they should seek seek help as soon as possible. Then for women in general, my advice is that you should try and make babies at your younger age group, because the more you wait, the more problems you will get. You may get somewhere along the way. And that's my advice that I will give to.
And what do you have to say?
And they should not be too stressful about it. Okay. It is a very stressful situation. And, I would advise that the couples will have to defend each other in order to reduce the stress. Defend each other to the in-laws and to their friends, so that they will not put too much stress on themselves.
So the emphasis has been on couples. So it means that when you are coming to seek fertility treatment, you don't come alone. You should come together, because it's not just one party who needs the help. It's the couple who makes the baby, isn't it?
And that is very, very important, especially the first attendance. The couple will have to come together. The man and the woman should come together so that they can be interviewed from the onset.
Okay. This has been quite insightful. This is the first part of the video. I hope you've enjoyed watching the first part, which is on infertility. It's quite exhaustive, so we have to do a second part which just talks about IVF. Thank you for watching this video. If you have enjoyed it, like, subscribe, and share. And thank you, Daddy, for this wonderful talk. This man here is my inspiration. That's why I'm a doctor today. So thank you. It's been quite fun having him as the first guest. Thank you, Daddy.
Thank you.